All right. Good morning, afternoon, evening, everyone, wherever you are. Again, thank you for joining us for this important discussion. I think so on the intersection of environmental factors and cardiovascular health. Just to introduce, I'm Dr. Khurram Nasir and one of the associate editors for Journal of American College of Cardiology. And it is truly a privilege to be here with Dr. Wenli, who will delve with us in the compelling findings of their latest research will be published in Journal of American College of Cardiology, really exploring the relationships between cold spells and myocardial infarction. Just to set the stage, thinking out loud, 2023 was the warmest year on record. And June 2024 and the last 2 months continued this trend at, I would say, the Earth's 13th consecutive warmest month. And in this scenario, it is so easy to focus solely on the health risk posed by the rising temperature and global warming. However, a fresh breath of air coming from Dr. Nee's study reminding us that let's not forget that as the world heats up, the cold, hard reality is that cold spells still can pose significant cardiovascular risk, especially for myocardial infarction, which still remains the leading cause of death worldwide. Even in US alone, an MI occurs every 42nd. And now with the growing body of evidence, environmental factors that we have seen in the past, such as fine particulate air pollution, now we have some interesting data coming from Sweden on the impact of low temperature and especially the cold spell. So I will pass on to Dr. Nee to just introduce herself and her study and give us more insights. Why did you do the study? Wow, what were
Yeah,
the methods and what were the key findings?
yeah. Thank you so much for Dr. Nancy. I'm so happy to be here. Yes, as you were talking at the beginning, climate change mainly leading to the global warming, but it can also indirectly cause some specific region or the complex weather pattern. For example, some specific region cold weather, less as urea. Something because the climate change causes some shift in the atmospheric on some oceanic circulation pattern. Yeah, so climate change not only causes the global warming, but also cause some specific region like the European cold weather. Yeah, that's why we do this study. It's a very good question. Yeah, as we all know, low exposed to low temperature and cold spell were associated with increased risk of various diseases. And the previous study also reported the low temperature had a greater cardiovascular burden than high temperature. And most of the study focus on the low temperature and the myocardial infarction was conducted in the temporal climate. And regarding for more specific focus on the extreme weather cold spell, the research is very limited. And Sweden is known for the cold region and with more common cold spells. Therefore, we conducted this analysis to explore the short-term effect, the short-term exposure to lower temperature and cold spells associated with the myocardial infarction hospital during the cold season from 2005 to the 2019 in Sweden. And so through this nationwide study with over 120,000 participants, we found that short-term exposure to the lower air temperature and cold spells at 2 to 6 days were associated with increased risk of myocardial infarction hospital admission and its subtypes, non-ST segment elevation myocardial infarction and ST segment elevated myocardial infarctions. Specifically, we found the transit reductions in risk of myocardial infarction immediately after exposed to low temperature and cold spells at like 0 to 1 day, followed by increased risk risk of myocardial infarction in subsequent 2 to 6 days. And moreover, we also found the exposed to lower air temperature and cold spells had independent effects on myocardial infarction. And they also both have the comparable effects on the increased risk of first time and the recurrence myocardial infarction.
That's perfect. Congratulations again on such a beautiful study at JACC. We are always on the lookout for research like that are pushing the boundaries of our understanding and also has to, I would say, the potential to reshape clinical practice. I can tell you what this study exactly did that. And what first drew us to this study was really your robust design, that this amazing sweetheart registry. We think it's a treasure trove of high quality data that covers 90% of all MI cases in Sweden. I wish these type of national registries occur everywhere. Now, for me, what this study set apart was just the rigorous methodology that you pointed out, but I would say the precision that you achieve with advanced learning techniques and analyzing the temperature at 1 kilometer square scale. You really captured the noise impact of cold spells and a sudden drop in temperature on MI risk. And I hope we can look at other outcomes in the future. And more importantly, it wasn't just an aggregate data, individual level. You had time stratified insights and you effectively controlled the confounding factors. For me, this offered a level of reliability that I have really seen in other environmental studies. And uniquely, what was important, at least what piqued our interest, was the novel biphasic pattern of MI risk following cord exposure. Of course, there is a reduction in MI risk. There is a reduction immediately after exposure, but
Yes.
followed by a significant increase in the days follow. Now, I would love to hear your thoughts. What could be the underlying mechanism, and number one, and what type of studies would be needed to understand this biphasic pattern? And thirdly, what type of interventions should we consider in the future to overcome the impact that we are seeing with this novel biphasic pattern of MI risk?
Yes, thank you for this very good question. Firstly, this temporal pattern may indict delayed effects of cold exposure on myocardial infarction risk. Actually, understanding this code to the myocardial infarction risk lag sequence may be important because it allowed us to identify the risk exposure window, which may be very important or very useful to design or implement targeted prevented interventions. However, actually, to be honest, the underlying mechanism of this temporal pattern remain largely elusive. But this immediate or short-lived protective effects may be due to the behavior modification and the service disruption during the severe cold weather. For example, when aware of the impending severe cold condition within ensuing 2 days, in the video, especially older people may select to stay indoor, thereby mitigation the risk, exposure risk. However, if it's cold for several days, a bit long day, one usually cannot avoid go outside, thereby increase the risk. And another side, the service disruption due to the very extreme weather could deter the healthcare seeking and lead to the lower initial hospital admission rate, followed by an increase as the service resume. Yeah, and for the potential prevention strategy, I think the pharma side, because I didn't explore this, but the pharma side, I think the first important, we should have some education for the public education. For example, the government can organize some action to tell the public the cold exposure is a risk factor for the cardiovascular health. So should tell the population should be keep the warm and another keep warm get enough clothes, and another side the government can provide some support for the warm. For example, for some vulnerable population or the some poor population, low income population, the government should provide some enough heating or some warm clothes like this. Yeah.
No, I think so. You've really hit on the nail, especially on the health equity piece, is that clearly as we move forward, we have to keep that issue, equity, at forefront. And we know that cold-related health risks significantly affect the marginalized and the low-income communities who really
Yeah.
would lack the resources, and definitely an indication that the interventions needs to be inclusive, from targeted outreach programs to subsidized heating, ensuring that no one is left behind. So, for me, what I'm taking is that this study is truly challenging us, saying it's time to rethink how we factor in environmental condition when assessing cardiovascular risk, especially in regions which are vulnerable to extreme temperature swings. And maybe our current models are underestimating the true impact of cold spells on cardiovascular and other. Now, the question I have, and I'm also intrigued, that there is significant advancement in AI-driven geospatial capabilities. I think we are better equipped than ever. How do we take these tools and apply to simulate, I would say, future climate scenarios, pinpoint vulnerable population? And do you think now it's time for us to think to proactively deploy these tools in public health alerts so that, for example, our health system facilities are prepared to meet increased demands during cold spells or reaching out to more high risk population? How are you seeing the future of, I would say, the geospatial capabilities in depth that you were able to deploy it in the Sweetheart study?
Sorry, you mean the geospace
Geospatial,
capability?
yeah. Yes.
You mean do some analysis or some? Sorry, I'm not
No,
very
I'm
sure.
just saying that you were able to identify daily temperature changes
Yeah.
by machine learning on 1 kilometer square techniques. And now, we have all these data on a regular basis.
Yeah.
How do we take these capabilities? Is it time that we place that into our public health alerts so we can think
Yeah.
ahead and kind of
Yeah.
guide the health systems and even population? So where do you see the future for these type
Yeah.
of capabilities?
It's very, very good suggestion and comments. Actually, I know not my colleagues, some research group, they do some of this app. It's tool for the public health alert, but maybe they because most people focus on climate change, high temperature. They do like this. If the temperature decrease how much, and then they will have the alert to some. For example, they have this app. If you download this app in your phone, if it's cold spell or very serious cold condition, they will send the alert that tell people it's a bit dangerous condition, so please keep warm or something. It's a very good question. It's a very good suggestion. So some people are doing this. I hope in future, maybe I'm not in Sweden, maybe in Sweden, some of this group also can do this.
Yeah, no, this is brilliant. I'm just thinking out loud that what does it mean for us in cardiology, or even so a big question would come at what does it mean for us as clinician and researcher? I just think that your study is really guiding us into this whole direction and saying, we have to have a look.
Mm.
It's not just physicians, but researchers, I think public health workers, political scientists,
Yeah.
legislators, community leaders, all we need to come onto the same table and create a strategy that we can address, I would say, the dual threat. Of course, we are so much focused on global warming that I want to make sure that we also understand that or don't ignore the ill effects of cold spells by these
Yeah.
temperature variations. But how do you see this playing out outside Sweden? Do you think these findings are going to be, I would say, applicable outside Sweden, Nordic countries? Do we need to do more studies to at least validate these findings?
Mm.
And what's the next step for us? What would you suggest?
Yeah, for the first question, although I want to answer, although this study only conducted in the Sweden, but the Sweden is in Sweden located in the Northern European countries. So other Northern European countries, for example, Finland, Norway, Denmark, and Iceland, they had the similar climate. Climate and those northern European countries, they also have a bit somewhat similar demographic or advanced heating system or advanced robust the healthcare system. So our study, although only conducted in the Sweden, but our finding can provide insight into the impact of low temperature and cold spell on myocardial infarction from the Northern European perspective. So I think our research, our finding can generalize to the Northern European. Yeah, this is one. Of course, because our study only conducted in a bit the a relative cold region. So if our study generalized to the other region, for example, tropical or a bit hot region, and with limited info construction, low income country or the different demography, we should be done cautiously. Yes, of course, it's good if we can have the global data to explore the effects of low temperature and cold spell on myocardial infarction global. But sometimes it's very difficult for us to get this data. Actually, we also conduct this analysis in Germany, but also only conduct in the European. We also found the similar results. Yeah, for our next step, of course, we hope we can do the global study, but we need to organize, collaborate with more research, yeah, something like this. And actually, for us, for our next step, we really want to explore the long-term effects. Because now we only focus on short-term effects, but we also want to focus on long-term effects. The people live in a different region if they have the different effects. So it's our next step. I hope more and more research from the different country and from different region explore this low temperature and cold spell on the myocardial infarction, so we can get the more evidence. We can combine together and provide the global evidence.
That's amazing, Dr. Nia. I think so. You really hit on the nail, and more importantly, I couldn't agree more on the power of collaboration and multinational partnership.
Yeah.
Because I think the climate change is the biggest threat not only to health but the rest of the world. So it's time for us. It's a wake up call and it's calling us to reconsider how we address environmental factors, at least for a cardiologist and cardiovascular health, and certainly the increasingly unpredictable climate patterns. So, and then again, I would really, first of all, thank you so much for joining us. And I'm so excited about this study. At least at JACC, we are very excited about your presentation at ESC. But before we end, I just wanted to give you some, if you have any final thoughts for us, any final comments, anything that you want to share with us.
Actually, I really want to say, as you at the beginning said, climate change is a very hot topic. Maybe more
Yes.
and more people focus on the climate change or heat wave. But actually, the cold exposure is also an important, research topic. Especially many publication or reported the low temperature had the greater mortality burden or cardiovascular burden than a high temperature. So I also really want to say, maybe research, more and more research also should focus on cold spell, not only for the heat wave. Do you
Oh,
agree?
you're
Also, yeah, also like even the US, the heat wave is very important, but in the winter it's still very cold, and
exactly.
especially in USA, a lot of homeless. So I think government need to provide more
I,
support for.
I clearly agree, especially when I was in the Northeast, by April, I was like, okay, this is more than enough. But, your final message is very inspiring. You're asking us to approach these challenges with, I would say, both caution and optimism. And, I think so. The key insight from your paper and this discussion is that we have to address the full spectrum of temperature related healthcare risk. It's crucial if we want to ensure that our health systems are resilient and our populations are prepared for what lies ahead. So I would say, let's not just weather the storm, let's emerge stronger on the other side together. So thank you so
Yeah.
much again for joining us, and a wonderful paper. And we look forward to an exciting presentation at ESC.
Thank you so much, Dr. Nasir. Always a pleasure. It's
Oh,
very exciting. Thank you so
yeah.
much.